Everyone, I think we'll make a start. I'm Margaret Whoriskey. I head up Technology Enabled Care at Scottish Government. So I'm delighted to welcome you all here this morning. Just by way of housekeeping, there's no fire alarm expected. So if the fire alarm goes off, please exit by the exit signs and you'll be directed towards the muster stations. There's refreshments on the 2 floors and obviously toilets as well. If you have any questions about workshops or parallel sessions, or just go to the registration desk and we'll make sure that your questions are answered. So really it's for me to introduce on behalf of our partners to Digi Fest 2019. This year it's bigger and hopefully better than before. We've moved, as you will know, to a 2-day event, and I think that's partly to reflect the range of work and interests that there is in digital health and care across Scotland. So we've been delighted to have collaborated with our partners. So CCPS have been a key partner in sort of ensuring that we engage effectively with the range of social care. So I think there's a lot in the programme this year, which hopefully people will find of interest. But also working with a range of our other partners who've been involved in planning the event. Okay, so we have 950 people registered, or 950 registrations, I should say. Some of them will be the same people for the 2 days, but 950 registrations over the next 2 days, including the public lecture, which Sir Harry Burns is going to be delivering tomorrow evening. So again, that's something we haven't done before. We've got 150 speakers and contributors. So I think what that says is actually people are participating as members of the conference, but they're also contributing in terms of some of the work underway. So there's a lot going on. And we've got 25 international speakers as well as a number of international delegates who've also been involved in events during the week. We've got exhibitors as well, and I'll say a little bit about that in a minute. But I was really pleased to be part of our Digi Inventors Awards last night. We had 4 young people, aged 13 and 14, 4 girls from Mar Academy School in Troon. And they won the Andy Murray-sponsored Digi Inventors Challenge for 2019. And they came and spoke to a range of very senior people, including the Minister, last night, talked about the app that they've developed to encourage healthy eating at school. And, I was sort of in awe of their ability, I think, to have developed this and to have been able to stand and speak to it. So I suppose it gave me some assurance that there's a new generation coming up that I'm sure will do better than those of us that have been here for a long time trying to navigate digital. There was also a number of site visits that CCPS and partners put on, and again I think that's something we might want to do more of and maybe advertise more, because again that was an opportunity for people to see things in action. So we've attendees from all over Scotland, health, care, third sector, independent care sector, housing, academia, industry and others, and again most of Scotland I think is represented today, so please do use the opportunity. I know there's a busy programme, but it's also an opportunity to network and to talk to people and hopefully make connections so that you follow up after the event as opposed to just saying that was a really good conference, I'll come back again next year. So really the conference is really an opportunity to connect people in, signpost you to work that's underway, but really there's a huge opportunity in Scotland I think to collaborate and learn from each other, and obviously from our international speakers and contributors as well. I should say that in October, as part of Digi Health and Care Fest, the Health and Care Alliance led Discover Digital. Now this is the second year we've ran Discover Digital. Again, it was a more ambitious programme this year. There was 750 people participated in 5 locations in Scotland. Now this is largely targeted at the public. So we're trying to look at how do we engage citizens and the public in what's available. So we had industry partners and health and care organisations interacting with people in the Glasgow Science Centre and Dundee Science Centre. We had Inverness, we had Dumfries and Galloway and Aberdeen. And again, I think there'll be a session during the conference, the Alliance are leading, that will be feeding back on some of the key themes on that and how we do further engagement going forward. So again, another first for us at this conference. We're going to try and increase audience participation by using Mentimeter. So you've got the web link there. So if you can note that down and put it into your phone, and also note down the participant code. And at a point during the panel discussion, there'll be an opportunity for you to answer some sort of questions that we have, just to get a bit of a temperature check in terms of the audience, but also to put in some questions yourself. There'll be a roving mic too. So hopefully people will have a chance. We're hoping this will work. Always worried at a technology conference when you use technology and it doesn't quite work. But anyway, fingers crossed. We're just wanting to see if it adds to it. So any feedback would be welcome. So as I say, we're always really grateful for our exhibitors and sponsors for the conference. We do make the conference free to participants because I think the aim is that we try and have an inclusive approach to people so that cost isn't a barrier to attend. So we're really grateful that we do have a range of exhibitors, and they're located on the ground floor in the main. And please encourage you to go and talk to our exhibitors, and they're interested in hearing what your sort of priorities are, what some of the challenges are, what some of their developments and products can maybe assist with going forward. So I think that's all I need to say really by way of introduction. I'm really looking forward to the next 2 days. It is a packed programme, lots going on, but it's my pleasure now to hand over to our co-chairs for this morning. Christine McLaughlin, who I'm sure is well known to people. Christine is currently the Director of Health, Finance, Corporate Governance and Value in Scottish Government, so a big title and a big responsibility. But Christine's also been the responsible Director in Scottish Government for Digital Health and Care over the past 18 months or so, and has given real leadership and support to this. I'm delighted that Christine's able to join us this morning and co-chair the session. And Christine will be joined by SallyAnn Kelly, who's Chief Executive of Aberlour Childcare Trust. And again, I think trying to look at a true partnership between sort of Scottish Government health and social care in terms of the conference. So I'll hand over to Christine for the next stage.
Thank you. Check my mic's on. No. Can you hear? Good, thank you, because I'm a bit croaky. So it's great to be here this morning. As Margaret said, it's a really big event for us. I think it's great to see people from all walks of life represented here today. I was just thinking back to last year when I was sitting at home watching it on the webcast. So I don't know if we're doing that again this morning, aren't we? So welcome to anybody, I don't know where the camera is, that's watching us from home or from wherever you are. So we got a great session this morning with illustrious panel that are sitting here waiting to take your questions. So I'm the warm-up to a few people who are going to give us some thoughts to provoke and stimulate some good debate and conversation this morning. What I think I'd say to you is that for me is, and everything we've done in digital so far, this is all about thinking digital in everything we do. It's not about digital being some standalone extra stream of work, but thinking about how we use digital to deliver the services that we need for the citizens to be able to improve quality of life for people. So it's just so important. I think, I'm sure everyone will have that theme, but that we think first about the services we deliver and how technology helps us to do that. So it gives me great pleasure to introduce our first speaker, who's Luisella Giani, who you probably give a clue by the name, is Italian. Luisella is going to speak to us she comes from Oracle. She's going to give us some insights into her experience of digital transformation in working with global companies. She also describes herself as a serial expat, having lived in 7 countries, and I'm wondering whether Scotland might want to be on your list for your 8th or 9th, Luisella, but we'll see how you get on today. So if I'd like to just welcome you up to the stage to give us your thoughts and your insights. Thank you.
So, good morning to everyone, and yes, I'm Italian. I mean, as you can guess from my name and also from my accent, and my first time in Glasgow. So I arrived yesterday evening, and I mean, I had like a short walk, in the city center. So probably I need to come, in spring or in summer to better enjoy, I think, Scotland, but was already, it's already starting. So today, what I would like to do, I mean, I will have first a kind of introduction about what digital mean, and especially new technologies. There is also a reason, I'm working in Oracle since a bit less than 3 years, and my job, I'm an advisor. Mainly, I'm working usually with executive to just advise them about what to do in digital. Why? Because before joining Oracle, I was myself head of digital for a few companies. I have a degree on artificial intelligence that I taken when was not a buzzword, so, a long time ago when it was a really exotic discipline. And so, due to my advisor role, I think I have this kind of high-level vision on a lot of different industries. And what is also extremely interesting, I think right now, that all these, sometimes the division industry by industry, or even B2B, B2C, and so on, is less and less valid because, I remember manufacturing companies, they want to just get inspired by retail or cosmetic companies. So that's, it can happen. I would like to start today with one example I do like to mention. I do have a degree on artificial intelligence, so I can, as you can imagine, I'm really interested also to the evolution of robotics, AI, and so on. And, I met, this small robot, she's called Nora. I met her in Brussels, in a place that is called Living Tomorrow. So is a kind of private university where they are showing all the latest technology. Often those technology are pilots, so it's not something that is still released. So Nora was one of these pilots. She was made together with the University of Ghent. And actually, they programmed her to be a sommelier in the one Michelin star restaurant part of the building. And they thought, okay, if you understand a bit of also, it's not so difficult. I mean, actually, you pair like wine with food. So finally, you pair some database. Shouldn't be so difficult. So, she was doing her work pretty well. But at certain moments, they decided to retire her. She was fired almost. And also robots can be fired. And why? What's the reason? People, they were extremely uncomfortable talking with her. People they didn't like, actually, she was giving good advice about how to prepare food and wine. But, people say, no, sorry, I don't like to speak with a robot. A sommelier is a sommelier, should give a certain charm and so on. And it's really funny because a similar situation happened 1 year ago. There is this hotel in Japan, it's called Anan, something similar, that decided to hire as concierge. This is a robot lady, and there is a robot lady and a couple of robot dinosaurs. And they were doing, all the reception. You see, it's kind of complex. The person click a button, then there is all the digital sign, and so on. But so finally, what happened? They decided, after less than 1 year, having those robots in place, to fire them all, because again, people were extremely uncomfortable, and finally, something that they thought, okay, will be funny, will be easy, will be something that facilitate the experience, give a better experience, was actually the contrary. So they decided to just change. What does it mean? Often this introduction, because it was a bit provocative compared, to, okay, everything should be digitalized, everything or machine will substitute us. I don't think it's true. We need to understand what machines are good at and what humans are good at. And then we need to balance both. What is happening today, we do see a lot of new technologies. We had a shift. A few years ago, we were speaking about what are called SMAC. It means social, mobile, analytics, and cloud. Since a couple of years, the technology landscape changed. So we are entering in what is called the post-digital era. So the technology where we should invest right now are artificial intelligence, blockchain, Internet of Things. And what is common to all those technologies is the data. So without the data, you can't have machine learning, that is, one branch of AI running. You can't, data is what sensors are collecting and what permit us also to deliver finally what we do call hyper-connected but also hyper-personalized experiences. And this is extremely relevant to mention because, and from my point of view, I do work with technology. And what does it mean with technology? Because I consider technology as an enabler of all the different activities we do want to do. So again, it's extremely important to understand what's the value that technology brings us. So it's not, technology for technology's sake, but why we are doing something. Start from this and then use the best technology we can have today. Tomorrow will be something else, but our goal, our objectives are not changing. And this is also, I was trying to understand, also applied to, let's say, healthcare and also medicine in general, what all those new technology mean. And for me, they are, we are kind of a fantastic moment because I think that what is possible today was not possible only a few years ago. Often, there are all the difficulties, there is something new, all the difficulties, resistance, understanding what I do with this, do I'm doing right, and so on. So my advice is try, pilot, and allow to do mistake, because when there is something new, it's normal. And if you just try to think about data and new technologies applied to medicine, you do have mainly, I was taking back this definition of the P for medicine. What does it mean? Thanks to data mainly, but also to other technologies, what we can do? We can first have personalized or precise technology. What does it mean? I do collect data about a patient. I can match this data about a patient also with, a big database of patients similar to him or to her, and I just can identify some patterns. Also, machine learning can help me to identify some patterns and also to suggest me what to do in a certain situation. What does it mean? The advice, the prescription that I can suggest to this person are heavily personalized, so hopefully are much better than to have the average and the standard. I can be predictive, and this is also a big impact because, so far actually care was mainly based into what happened to the previous patient, what happened in the past. Being predictive, it means to also think what can happen in the future. I do have, and again, I mentioned data, but not only data, behaviors are translated into data. Data we do mention because is what we can analyze, but I can analyze all the historical data. I can analyze also real-time information because, again, this is linked to the fact, just imagine someone as a wristband, as a smartwatch, as a Fitbit, as something that is tracking also all the information about him. So I can have this continuous information. I can predict if a person will have even an heart attack, maybe in 1 or 2 hours. And we are working with a company called Be Secure that actually they are analyzing. They developed a tissue that actually they put into either the wheel of a car, or they have T-shirts, so they can put these in different form. But what it does, actually this is able to track your ECG and to just notify with 1 hour in advance if you are having, if you are really stressed or if you are really tired. So they use for, workers that they have to drive a lot or they are manipulating a really dangerous machine, also as a prevention of accident. And this is happening again, and this is possible today, and obviously also the information collected can help also to improve, the work shift also for the future. Also connected to this is preventive, because if I can predict, I can also prevent. Obviously, I can give advices in advance. And then I think also one really important area is we are becoming participatory. What does it mean? People, thanks to different forms, it could be social network, it could be communities, but a lot of digital enable people to communicate each other. And this is proved to be extremely powerful, because especially if I have a chronic disease or something that is extremely niche, you know, I feel unique in the negative sense, you know, that no one else can understand me. So the fact that digital allow me to talk with people like me, to have also advices from professional and so on in a really simple, but I would say also anonymous way, is extremely important, and that's the reason why we call participatory medicine. And also, on top of it, what we start seeing, and I hope to see it more in the future, that patients become co-innovators. So they are like, it's not only the feedback loop, you know, it's not asking them their feedback, but it's asking them to participate, to develop new services, understanding what is good for them, because I will provide some example later. We may have some understanding that maybe is not what the patient want. So all of this simply to say that, I mean, these are like technology is enabling, and we do see what are the trends now in the market, that we are all becoming service-centric, but from different aspects, you know. We do see trends like, okay, we are all aging, you know. I don't need, I think, to remind you the data and the projection, but, you know, aging population and also aging workforce. It means that also when we are speaking about caregivers, professional, nurses, and so on, we can foresee that we will have a long demand, a big demand for more people that are in healthcare profession. Healthcare providers are also looking, I mean, their margins are shrinking for a lot of different reasons. So it means they're looking for new business model. A new business model, often what does it mean? New services. So I could mention also in this case, you think about Netflix. Netflix is apparently not related at all to healthcare, but if you think about their business model, it's based on subscription, and actually Netflix is using your own data to offer you personalized content and also to predict what you will like. Okay, some healthcare providers are thinking why we don't become the Netflix of healthcare, why we don't offer subscription model, why we don't try to have something that is hyper-personalized with this kind of model that is more popular in media or in other companies. And then, you know, extremely important is all the area related to the patient-centric or patient engagement. What does it mean? There is a big shift because with the digital, people, they become also aware of what they should or they could expect by an healthcare provider. So in a way, they expect that their experience is really simple, is easy, and I use this terminology is friction. What does it mean? That is like reducing any kind of friction that you can have. And this is part, if you think, this is the key of offering customer experience. So customer experience mean also creating not only something, it's not only something functional, but something that is preventing, something that understands you before you want something. And often, you know, I'm using a terminology for retail, but I think it's still valid. We are talking about micro moment. What is a micro moment? It's this moment that's millisecond where you are going to want something. And this something could be an information, could be an action, could be something you want to buy. So good companies today, what they try to do, they try to identify, intercept this micro moment and offer you already the information you're looking for 1 second before you are looking for it. And this means also reduction, because you can really be empathetic with a person because you are offering in advance what the person is looking for. What is the big shift also? Patients are not anymore patients, are consumers. You know, they are aware about what they want. They are like mature. They are in a way adult. They pretend a lot of stuff. So I was reading a research I will showing you later today. It seems that doctor-patient relations is extremely important for them, but luckily they are all disappointed by it, because still I think even the way of you know, the information often is by anecdote, is not fact-based. The people, they would like to have more information. And there is also another phenomenon that is really interesting, is the Dr. Google. What does it mean? People first, they look into Google, and I had a case with my mother, and I had a long discussion with her, because, I mean, one of our uncle was, I mean, he had a surgery, and my mother, she was really worried, and she started looking into Google, and she tried for 40 minutes to convince me that she was right and the doctor was wrong, because she had a look to the exam, and based on what she could find on Google, she was like giving the diagnosis that obviously was horrible, you know, something tremendous that should in theory happen to my uncle. Luckily wasn't true, but this is, you know, the level of sometimes knowledge and misknowledge that is shared, because for sure there is these people, they do want to know. Again, they want to be empowered to know what is happening. And the risk is that if the doctor is not informing them, they are looking for other sources, I mean, with the result to create a lot of anxiety and maybe really wrong assumption. And also, you know, they just expect that all the records are electronically recorded and they can have access to it. But not only them, but also everyone, all the clinicians could have access to those records. And, you know, as I told you, I like also to provide some example of what some institutions are doing. I mean, this is an example from the Australian government. Actually, what they've done already a few years ago, they started up this project. Oh, sorry. It's called My Health Record System. And I mean, it's simple, but I mean, it's extremely useful. What does it mean? It's a digitalized way where you do have access to all your records, I mean, related to your health. Sorry, I don't know why this slide doesn't want to stay. Maybe there is some kind of automatic change. But I think this is extremely interesting also because you see, citizens, they have the possibility to opt in and opt out. And I think many are opting in, so it's not something mandatory, but I mean, many are requesting this. But also, what is also important, I mean, the direct saving, Deloitte calculated that is kind of big, because it's 11.5 billion Australian dollar in the next 15 years. So there are really good reasons. It's not only for the patient that is something really good, but also for the Australian government that is really positive. So I'm changing slide because, you know, doesn't want to stay. And this is the survey I was mentioning you before. That is scaring, you know. I mean, this was a survey, was done less than 2 years ago. It was worldwide, so 30,000 patients, 700 doctors, and so on. But, you know, it says that even in case those patients have chronic disease, the doctor doesn't remind them they have to really have some healthy habits, like even the classic, you know, eat well, do exercise, and so on, but probably could be extremely helpful for those people with chronic disease. If they miss an appointment or if they don't get a prescription, they are not contacted ever, never. So, I mean, just imagine, this is like for chronic disease could be really causing death. So it's something really serious. And also, 40% of the doctors, they can't access to the electronic records. What does it mean? The problem is that if someone is go to an hospital as an emergency, so all those information in a way can be lost. So you can't really offer a kind of continuous care. And so this is, you know, is technology actually allow us to fix it. Is more sometime not, probably there are a lot of reasons, but also sometimes human behavior that is not embracing technology. I mean, I think chronic disease, I would like to give you a couple of examples, because for me, it's something in a way that we can have control of it, but for some reason we are not able to take actions that are effective. You know, those are some data, but, you know, again, I think you are aware of it, so I'm not going to stress out too much, but, you know, people that are over 65, 70% of them, they do suffer of chronic disease. So the impact is extremely extensive. And then there is also, it's not only, the real problem is the adherence to the treatment. So at least 50% or more, they don't adhere to the treatment, and so this also can cause premature death. So it's really simple and something we should be concerned about. And, you know, I was thinking about a paradox. You know, if you do have a package that is from DHL, okay, you can actually track this DHL package in all the possible way you can imagine. So it means, I mean, you do have a barcode, you can follow the package online, you can see it was dispatched, it's arrived, it's expected in 2 hours, you can call DHL to understand where your package is. Okay, so perfect service. Then maybe some time is delayed, okay, but, but at least you know where the package is. Could be lost, but at least you have some tracking. If you think about us, human beings, okay, this is a person with diabetes, for instance, we are not tracked, okay? So it means that even when you are taking some medication, even when you do some activities, now you do have some apps that are start tracking you, but the majority of the time is isolated, is like in silos. You don't have like something that is following you 360 degrees, something that is also correlating. Maybe maybe your mood is not perfect, could be dependent by some medicine, could be dependent by something. So compared to packages, we are nowhere. So we need to do something because, it's impossible that a package is better tracked than us. So, and one example of a project we have done back to, it's already a few years ago. This project is from 2015. It was done with a Spanish company called Zerintia. I think it's really interesting because it was using different technologies for having the tracking. But tracking, what does it mean? For patients with chronic disease that were hospitalized and they were back at home. So to follow them, not only when they were at hospital, but also to be sure that they were following the treatment and so on. So how this was done, there are a few areas. I mean, obviously the first area is related to monitoring. So you do have technology that you can be smartwatch, wristband, Fitbit, and so on, that are tracking your basic information about the patient. Okay, then you do have, this is a beacon. Also, a beacon usually is put in a room for having indoor tracking. So what does it mean? I can understand where the person is, so either in the hospital or also at home. So I can see if the person is moving in one place or another, and this could be extremely important in case of emergency, also to react. And as you see on this part, I mean, there is also a location console. This is actually it's called micro location. And then there is a console where you can track the patient, but also there is an alarm. So if something is not okay, there is an automatic alarm. All those data that obviously you collect, what you do with them, you analyze them again, and you analyze not only against the historical data about the individual, but against, all the different data that you have for similar patients, similar disease, and so on. And then that's the reason why you can be predictive, prescriptive, and personalized. Why? Because this patient has also a mobile application where he's reminded actually when he has to take a certain medicine. The application is asking, to fill some survey about how he is today, what the mood, and so on. So tracking also these information that are not only quantitative, but also qualitative about, how the patient is feeling. And also all those data are obviously analyzed. There is also the communication. Communication doesn't mean only with the patient, with the app, but also with the caregivers, with the relatives and so on, with the doctors. And so everyone can, in a way, track the person and be ready whenever is needed. And then also there is the advising part. Advisor, what does it mean? The application also can advise to the patient to do some activities based on all the information that are tracked. Again, this is possible. What is happening right now, many companies are piloting it because obviously, I mean, to scale it is in terms of cost and so on, could be something to be understood, but at least it's possible. And we do see some companies, it could be sometimes our healthcare provider. In other cases are also pharma companies that, because maybe, this is a service, part of a specific pharmacological treatment, and also the service is part of it, because this is also, when we are talking about service, sometimes, many companies are also opening up bundled services to understand it. So There is also, and I'm speeding up because it seems that I was talking a lot about some interesting stuff, I hope for you. So another key element for service, don't waste my time. And I think this is extremely important also for, let's say, younger people, because people, they really don't want to wait more than 15 minutes for having a feedback or a reply. And how you can avoid to waste people time with the digital empathy. What does it mean, digital empathy? It means to, in a way, anticipate people, what we were saying before about the micro moment, and just offer them what they are already looking for. And you can see a lot of metrics that could be important also when you want to digitalize services. That is also electronic communication, if you can book the appointment online, if you can cancel online, all these things that are possible, luckily are not so common yet, and so there is still a lot that we can do. I would like to show you, so I will show you only one of the video I wanted to show you today, but this is like one example from Turning Point. Oops, sorry. No? Okay, I'm just going to tell the story of Turning Point because it seems that doesn't want to play. But okay, not sure if you know Turning Point, but actually is an association that is like take care of people with some disability or substance abuse. So for them, it's absolutely important that they can be present at any time in any different devices and can really react because they need to face a lot of emergency situation. So actually what they've done, they decided to digitalize a lot of the activities they are doing, and also to and let's go here, what they are doing. They have like have direct access, so patients, they can have direct access to what is the treatment and also to the advice. So what does it mean? They can use all the digital channel, including also a chatbot that actually is a big support. And actually, and I suggest you, there is an article on Forbes, where you can read all the different details and how this is possible, because they just computerized all the medical records. So, these are easily accessible. And so it means they are like the response time is much shorter. And this is an example of something that can be really useful in offering a better service using digital. I'm just going to show only one other example, because I think for me this is absolutely important for the point I want to make. So this is a company from California. It's called Kaiser Permanente. Actually, what they do offer telehealth and self-service. So it means they do have nurses that are picking up the phone or replying to email and so on to offer some advices and services. So their problem was that they have a scarcity of nurses, and they wanted to optimize almost the time of the nurses doing really relevant activities. So what they thought, okay, let's start using digital. So they started with a really simple way, self-assessment questionnaire. And then actually, so the patients doing the self-assessment and the nurses look at it, and then, if it's the case, give the right advice to the patient in digital way, or calling, or with whatever is the best channel. And so is also evolving. But what I think is really interesting to notice it, and is also the main point about humans and machine. So you may think, okay, nurses are not picking up the phone, so people, they won't be any more happy about this and they will be disappointed about the service. Actually, it's the contrary. People, they do prefer to fill a questionnaire, or now they are developing a chatbot, instead of talking to a nurse. And there are a few reasons. First reason is also sometimes what they do ask is a bit private. So they feel embarrassed, okay, to ask certain information to a nurse. Second, because in this way they feel completely independent and empowered, because they can almost do it at any moment, any time. And you know, sometimes with the self-assessment questionnaire, you can already have the feedback. You know, that is not the Dr. Google, but is done by a professional that can really give you the right reply. So they feel empowered, they feel much more confident, and they do prefer the digital way instead of the talking to an arts. And so you see all the parameters, this is the survey, are all positive. And obviously what happened that they were able to divert 50% of the calls. So it means that those nurses can actually do activities that are much more relevant for them, and the patient is also happy. And obviously an evolution of it is also to develop in a really digital savvy way. So it means chatbot, voice bot, and so on, because and you know, if you think about a voice bot, you can directly ask and have a self-assessment is also much easier. So this is where a lot of companies are going. So I would like to close today with a question that is maybe slightly different to the question you ask yourself every day. So don't think about what is going to change. Think about what is not going to change. And this is extremely important also, especially when we think about you know, humans and machine. So I think as the Kaiser Permanente example, I think this was a kind of wrong assumption where humans are needed and where machine are not needed, okay? And I mean, the pilot and the survey demonstrated that actually machine in some cases can be better perceived than human. So what does it mean? I believe that there are some basic needs, I mean, that are like, and you know, certainty, variety, significance, and contribution. And those are the human needs. Then we can achieve this goal in several different ways. And you know, in the relationship with machine and technology, for me, the main message, understand when the machine is better than a human, I mean, don't be resistant, take the advantage. When the human is better of the machine, take the advantage of the human. So thanks a lot. I will be attending the panel later today, so for questions, I mean, we can have later during the panel. Thank you.
Okay, thanks very much to Luisella. And she said she'll be around for most of today. I'm sure some people want to give you some feedback on the what's not going to change there, Luisella. What we're going to do now is just watch a short video clip to give a bit more of a thought-provoking stimulation before we get into the panel session. So I'll see if I'm any better at playing a video now, if that's going to work. Is it this? I would practice this in advance. Do you want to do that for me, Callum?
Health and social care is changing. Health and social care is changing. Over the past decade, mobile technology has transformed the world we live in, from the way we watch television, listen to music, exercise, and how we communicate. Emerging technologies are starting to transform the way we care for and support citizens. From artificial intelligence and robotics to virtual reality and interconnected devices. Wearable technology already lets us monitor our health and well-being, providing insights and recommendations about changes we should make. Putting the individual at the centre, allowing them to navigate the system and take charge of their needs. In every walk of life, technology has the potential to improve well-being by making our society more efficient, connected, and equitable. The emergence of big data, cloud technologies, and smartphone adoption enables information to be linked together and processed for new insights. How can sharing this data across traditional health and care boundaries, while ensuring the individual is in control, transform relationships into genuine partnerships? How can it improve the quality of engagement and outcomes? Will new technology continue to benefit citizens who need support from the health and care system, while enabling staff, friends, and family to explore more meaningful activities with one another and the wider community? What can we do to ensure individuals can stay connected, feel safe and secure, and improve their quality of life? And how can we make sure citizens are at the centre of this brave new world? Together, we can put prevention and self-determination at the heart of digital health and care.
The conference, and I'm going to facilitate the next session, which is a panel discussion. Before I do that, I just want to say how pleased I am to be here, pleased to see the representation from the social care sector and the third sector in particular, in terms of the lead that we are taking within the digital world. And I speak as a chief executive of an organisation that has is just about to embark on a fairly significant investment in digitalisation. And one of the key things that we're looking at is what that means, because too many people still equate digitalisation with IT, and it's actually not. It's about us. It's about how we do our work and how we could potentially change how we do our work to get better outcomes and better results for the people who depend on us, either in services or in terms of support that we provide. So one of the things I think that I would like to encourage today is a conversation about what we think we need to change in terms of how we go about our work. Because for me, the fundamental thing that won't change over the next 10 to 20 years is humans' need for connection. So how do we actually provide and utilise and exploit the digital agenda at the same time as remaining compassionate, caring and person-centred? And that's something I'm sure the panel will reflect on too. I'm going to invite the panel up. Each of them are going to introduce themselves, and they're going to take a couple of minutes just to share with us a few reflections from what they've heard this morning from the speakers and from the animation film that we've heard. So if you could take your seats, that would be great, and we will start the introductions. And I think we'll just start with you, Margaret. Is that all right?
Okay, good morning. My name is Angela Currie.
Sorry, Angela.
Sorry. Did you ask me to start there?
I did. I called you Margaret. Sorry. Sorry.
Good morning, everyone. My name is Angela Currie, and I'm Director of Operations for a housing association called Blackwood Homes and Care. But we're fairly unique as a specialist housing association in that not only do we build houses for people with disabilities and rent them out all over Scotland, we also have a large care service as well, and we have care homes and care at home and housing support across Scotland as well. And I think probably the reason I'm invited to sit on the panel today is that we have been at the cutting edge of the digital transformation across Scotland, both as a housing provider and as a care provider. And both sides of our business are at quite different points on their journey towards that digital transformation. And we made a deliberate decision many years ago to focus on care first rather than housing, because the housing one might have been easier, but the important area for us to focus on as a business was around care, and with a key purpose of really empowering our service users to have more choice and control in the care that they receive and help them live their lives to the full. So in terms of a couple of reflections I wanted to share with you this morning, one is very much related to the point that SallyAnn just made about the social care sector. And Blackwood are a relatively medium-sized third sector care provider in Scotland. And we are heavily involved in that digital transformation journey. And now everyone else is as well. And there is a huge risk, but also a huge opportunity here for us to do far more collaboration around this issue. We have a finite amount of resources. We are third sector, we're not for profit. So if we're all off having our various business improvement and IT teams working on all of these issues, then that to me is potentially a bit of a waste, and we can come together and do lots more together. Now, CCPS are already on the case with this one, and there is a huge piece of work that is underway to harness the power of the sector in a better way to get that collaboration. So that's my first point. My second point is one that I ask myself every day, is are we always having or putting our customers, as we call them in Blackwood, rather than service users, are our customers at the heart of that digital transformation at every stage? Because as a bunch of professionals, we can quite easily sit in a room and convince ourselves that this is more important than that, so let's focus on it. Whereas if you sat your service users or customers in the room, they might tell you quite a different story about priorities. But the other bit for me is really interesting. We often look for the complex solution to our problem, and when you have your customers involved in that, they often can tell you what the much easier solution might be to that problem. So we do try to challenge ourselves quite regularly with that. How do you have meaningful engagement? And I don't mean how is your services customer focused or person centred. It's how do you get routine but really powerful engagement in that digital transformation process with customers at the heart of it. And I'm not sure we do enough talking about how you get that customer involvement, and therefore share some of our successes and failures, because there's definitely lots of ways you can do it, but not all of them are successful. So I think we should do more of that sharing.
Okay, thanks, Angela. Jonathan.
Good morning. I'm Jonathan Cameron, and this is day 8 in my new role as Deputy Director for Digital Health and Care in Scottish Government.
Got it fixed.
And certainly looking forward to speaking with you, as many of you as I can, over the next 2 days, and really looking forward to taking on the new role that I have. I'm just going to say 2 very brief points. I think a lot of what Angela's just said I completely agree with. I really want to see more collaboration, engagement, particularly across third sector and the care sector. Just by way of brief background, I have joined from NHS National Services Scotland, so I've worked in IT and e-health, more recently in data over the past 17 years. And data is an area that I do think we need to focus on as part of the strategy, and particularly building up the workforce and the skills that everybody needs in order to use this new digital technology. I also have a slight kind of concern that we might be giving people too much information. So I think that it's about the right information at the right time, giving people like AI tools that help them actually get to what they need to far more quickly. So I'll move on briefly, and as I say, really looking forward to speaking to as many people as possible today.
Okay, thanks, Jonathan. Peter.
Okay. Mati Vagio Ula ha mi tolit gadida vi an hio agus am do Vraingef Mayen me Giani Gooskenyu le Daydream Believer. Now, I have no idea if anybody was able to translate that, and I'm not even going to start. I'm just going to let you guess what I said. Anybody want to have a shot? How Daydream Believer got in there? No.
Favourite
Okay,
song?
fine. No, what happened was I am a keen user of technology in terms of person-centeredness. So Don McCaskill knows what I'm going to say. And that means that every morning I help my 16-year-old daughter, who's sometimes reluctant to greet the day, by going in, because she has an Alexa in her room, and I choose what she gets up to. Today, it was Daydream Believer. Last week, we had Nirvana, and we also had Sydney Devine last Friday, Tiny Bubbles. So for those of you not from Scotland, if you haven't heard about Sydney Devine, just Google away. You will find something that will interest you. I suppose to come back to the theme of person-centredness, I am the Chief Executive of the Care Inspectorate. And I think what SallyAnn said, and indeed what Luisella said very powerfully, fantastic presentation, thank you very much, was that it shouldn't be about the average determining what you get. It should be much more about ownership and drive towards what you need and being in control of that. And I think that's what we aspire to in terms of the use of technology and technology-enabled care. There were a couple of key points I wanted to communicate today, as well as the use of Alexa. I bet people will now use that for getting up in the morning more than perhaps they do. But anyway, and one is, as well as that citizen focus, it is to return to the theme of social care, because I think, having been involved now as the Technology-Enabled Care Board Chair for Scotland, there is more that I think we can do in the social care sphere, and we've already heard some of that in terms of the applications in Blackwood. But we have 13,500 services registered just in one sector alone, and that is within care homes for older people and adults. There are 33,000 people cared for and supported in Scotland. There is an absolutely golden opportunity for doing more, which is compassionate, kind, and centred around the needs of people within that particular part of the social care sector. And I suppose my second theme is very much following on from what Jonathan has said, and that is exploiting, I think, the possibilities for the use of technology-enabled care in the integration of health and care. We are really fortunate in Scotland because we have embodied in law 9 health and well-being outcomes that is driving our system towards better experience of services that support people within Scottish society. I think that what we can do more of, though, is inculcating a sense of belief within this leadership community in front of me today, and much beyond it, into how we can see transformation happening with person-centred, technology-enabled health and care. So I think the enabler that is technology is also the enabler that can mean person-centredness in integrated health and care in this country and beyond becomes something absolutely real. My final point, SallyAnn, would be that we are very fortunate to be sitting here with Digital Health and Care Institute just up the stairs, but also we have a Technology-Enabled Care Board, which means that we've invested in the ability to transform as a nation, and that relates to a strategic direction and a political buy-in that I think we have much more optimism and hope to see transformation really happening in the future, and it being truly citizen and person-centred care moving forward. Thank you.
Thanks, Peter. Lorraine, thank you.
Good morning, everyone. I'm Lorraine McMillan. My day job is as Chief Executive of East Renfrewshire Council, but today, I guess 2 most important roles I play is, firstly, as Joint Chair with Christine of the Digital Health and Care Portfolio, and the second one is as Chair of the Local Government Digital Partnership. So absolutely passionate about digital and absolutely see its implications for health and social care. So just building on what I think Angela started, Peter, Jonathan, everyone mentioned, was we need to put the person at the start of this, really at the centre. And in local government and Scottish Government, we've been strongly promoting the Scottish approach to service design. And when my colleagues hear about this, I think they think I'm going to be evangelical about digital technology. But what we're actually saying is you start with the needs of the person and then use digital to enable it. And if you get those 2 together, it becomes very, very powerful. So please keep that message in your head today. Is about digital, is about people. It's the start. You start with what the person needs and use digital to help. My second point, I guess, is linked to the presentation we had today and a sense of, are we in government and government-funded services now at a tipping point in terms of the technology? I've been to this conference before. Every year I see more technology, different things that are available. I was really interested in the comment that we were now in a post-digital era. I think we're still a long way away in practice from being in a post. I think we should be, maybe, but we're a long way away, and there's a lot of technology that's available now. And I was thinking back when I was preparing for today to my early career. So my degree's in physics, which is a strange career route I've had to get where I am, but it still influences my thinking. And one of the early projects I did, I worked in research and development, was to develop an oxygen sensor that would be used in operations. So I carefully developed an oxygen sensor and went to a hospital in Edinburgh, and we inserted this sensor in the middle of an operation so that we could tell if the person, what the oxygen level in the person's blood was. Now, prior to that, what happened was a nurse took a sample of the blood, took it down to a test, and half an hour later got the results. Now, if you're in the middle of a heart operation, half an hour is a long time to wait. So to develop an in vivo sensor for somebody actually in the operations was quite a fantastic thing. I have to say mine didn't actually work, but never mind. I have to say I also fainted in the middle of the operation. The patient actually came round quicker than I did, which was interesting. So hence maybe the change in career, I don't know. I don't like blood much. But what's interesting now is if I look at the technology I've got in my arm, I've got a smartwatch, I can do an ECG. Now, what I don't know is what to do with that information. It tells me it's fine, so I think it is interesting, and I don't know what I'd do if it said it wasn't fine. I suppose phone NHS 24. See Angelina sitting here. And it gives me a whole load of health information. In our family, we're a bit of the worried well, so we have a whole load we're also into technology, so as well as Alexa and all these other things, we've got a blood pressure monitor, but we've also got an oxygen monitor, which you can now buy off.
And works. And now works.
And now works, and it's a lot easier. You don't have to cut into a vein or anything like that. You put it in your finger, and it tells you your blood saturation, and you can buy it for a few pounds off famous websites that you'll know about, and many others, I'm sure. And I'm sure there's much more. I suppose my question is, I've got that in my arm for my ECG and my heart rate and all the other things. I've got all this kit at home. How many of our older people that we're working with have that in their home? How useful would it be? How can we start from the person, get the technology they need in their home, and then get that into, and then get that data, as we talked about, into the right people, the nurses and the caregivers who can use that data well, and how can we do that in a really person-centred approach?
Thanks, Lorraine. Finally, Jane, thank you.
Good morning, everyone. I feel a bit of a fraud coming at the end of all this. Illustrious colleagues who've got all these jokes to tell you, and I have none, so I'm sorry. I'm Jane Grant, the Chief Executive in NHS Greater Glasgow and Clyde. And I thought this morning was fascinating already, actually, in terms of hearing Louisa's presentation and all the things that are out there. And I think we probably all know that they exist, but seeing it in one presentation I thought was really, really powerful. So thank you for that. It was very good. In terms of the reflections, I started with two reflections, but I'm not sure they are pertinent now. Having heard other colleagues, I've learned a lot about Sydney Devine and Alexa this morning. I have a 17-year-old son, and I think I'm going to try that and see if I can be more successful than I currently am. I'm not sure about the Sydney Devine, but we'll see. But in terms of my reflections on what I saw, so one of the things we continue to struggle with, I think, is that whole system working, and we say it all and we all talk about whole system working, and if I asked all of you in here what that would look like, you would all say different things, I think. But this week I was talking to a GP, and he continued to talk about the fact that his colleagues have difficulty in seeing across the whole spectrum of data to actually do that multidisciplinary team working that we all aspire to, and putting the person at the centre of that. And still there is quite a lot of clunkiness in that system, so there is something about us really focusing on trying to get the correct information across the whole spectrum. And that isn't just health and care. It is incredibly important that that is there, but it's much wider than that. Clearly, there's a lot of checks and balances have to be put in place for that, because there is a lot of information governance and difficulty with that, but that is something we still haven't actually cracked it to the level we might. Huge progress has been made, but I think there's still a lot to do in that arena. And attached to that, I also thought that the challenge that we saw on the presentation about personalised medicine is a huge one that we must grasp. And we've been doing a bit of work with other colleagues across the university sector about how we might actually make that real. And that has got huge potential, both in terms of quality of care, but also in terms of resource utilisation. So I thought that was excellent, and is something that we really need to grasp. And my second observation was really about the range and potential of all the digitally enabling technologies that exist, and even those things on the screen that we saw. I mean, one of the things that we're all struggling with is the prevention agenda and how we actually make that real. but it has to be easy for people to do that. It has to be as easy for them to do that as to do something else. And while all of you in this room probably are technology savvy, because otherwise you probably wouldn't be here, it's actually not about us, it's about colleagues who are not in that camp and how we make it easy for them. I have an old mother-in-law who has embraced in the last year tablets, and she regales me with tablets every day and what she's doing on her tablet, and I actually never thought I'd see the day when she was able to do that. And so it is how we support people like her to actually use the technology that exists, but make it mainstream. There's a lot of good work going on, but it's not mainstream always, and a lot of pilots and so on, and how do we actually grasp the nettle of making that technology widely available and easy for people to use? So that's my 2 observations. Thank you.
Great, thank you, everybody. Really rich contributions there from the panel, setting up pretty well for our Q&A, which is going to commence now, and it'll take us through to 11:10. I'm going to invite Christine up to just take us through the Mentimeter. I don't know how many people have already visited the website and are logged in, ready to
go. And obviously, if anyone is at home watching this as well and wants to ask any question, that's your best route to do that. So I think we've also got roving mix in the room, as it says up there. Whilst we're just waiting to bring that up, does anyone have anything they want to kick us off with? A question for the panel?
How many people have logged on to menti.com? Is there a lot of people?
She might just now see the password for the Wi-Fi is Glasgow Green with capital G's. Glasgow Green, both G's are capital.
Okay, the Wi-Fi password for those who are struggling is Glasgow Green. Both the first G and the third G are capitals.
And it's TIC conference.
TIC conference is the Wi-Fi you're looking for.
Okay, so
we'll
move on.
Technology,
swiftly.
people. Will we just?
I think.
Is it coming? Yeah. It's the screen that's the problem. Are there any burning questions the audience have that we can start? There's one here. Right, we can't see them.
Can I see it? Should we do it this way? I suppose this is the living the dream of the reality that we're talking about. That pilots, sometimes things work in a pilot and then you roll them out and it doesn't quite do what you need it to do. So,
has that fixed the microphone?
Okay, right, fantastic. So, the first question, just to get you started, which is an easy one, is which sector do you represent? Just to give us an idea of the different backgrounds for people in the room. And it's great. I feel like it's almost like election night, and you're getting the results coming in. We're not going there. We're not going for it. That was all I was going to say. Okay, so that's strong representation across health care, voluntary sector. We'll maybe try and find out later on what the others are and what that bucket is as we go forward. Okay, that was a warm-up question. Do we have another one up there? What was the second question? One word to describe your thoughts after seeing the. Has that just come up just now from people's thoughts?
Yeah.
Good, isn't it? Good technology. Okay, interesting, excited.
That's good. Very positive.
Okay.
Something to build on.
What do you feel are the biggest priorities? Digital health and care. So citizen involvement and speed of change being the two biggest one. Data. It's probably not a surprise, there isn't it? Data governance is quite a big one there, isn't it? And I know in my day job that's one of the things that people often tell us is a really annoying, frustrating obstacle when you've got something really good to do and you can't actually share the data. So we know that that's something we've really got to people to focus on, isn't it?
Connectivity got 10%.
After today, I
interesting after this morning.
Okay, citizen involvement, obviously the main one. Okay, So that was just a trial for us. So over to you now to what you would like to ask the panel. And as you ask questions, they'll come up here. I think somebody will just be monitoring it just to have a look and make sure everything in there is entirely appropriate.
These are the questions that people are putting in.
So this is what we have so far from people. So panel.
Do you see that? Sorry, I mean.
Yeah. There's one around digital literacy amongst a large number of our older citizens, which will limit the positive impact of digital. What are we going to do about that in a sector that's potentially underfunded? Yes, on you go.
It is a challenge. But I think there's two aspects to it. I think we shouldn't overemphasise that there is a digital literacy problem. There is. There's also an opportunity. I think Jane talked about her mother-in-law. I did the same experience with my father-in-law, who suddenly at 89 discovered he could use a tablet and he couldn't really break it. So there's a confidence. The most important thing is making the technology easy or at some points invisible. If you put telehealth and telecare into someone's home and it's really good, they don't need to know the technology behind it. They might not need to do anything at all. So I think we've got to focus on the individual. There'll be many older people who use tablets, who use Skype. We do know that. A whole load of people, if they've got family abroad, family a distance away, will regularly use Skype. For that group, let's use the technology at the right level. But for most people, good technology should be easy to use. So if we get it right, we will make it easy. So maybe not focus on the digital literacy, focus on making it easy for people.
Okay. Anybody else want to say anything? There's actually a few questions here about capacity coming up. So it seems to be a big issue for the audience in here anyway.
SallyAnn, could I just add, I think the biggest weapon we have is our workforce. So if our workforce are comfortable, knowledgeable and able to manage most types of digital technology, then by default we'll address, I think, the skills gap out there. Most people, my parents included, seem to have a ever-increasing frequency of visits to health professionals as they get older. They live in their own homes, so they don't have a housing association like the one I work, for example, with staff going in there to help their skills. So if they didn't have a family who could help them, they would not be as advanced as they are in their own digital journey. But the workforce, in terms of the health services that they have to access, would be incredibly important. So I think regardless of where we work and what kind of jobs our workforces do, they all should be highly skilled people in terms of their digital abilities, and that would be a great way to move forward.
Okay, thank you, Angela.
Okay, I think our mics are working now, so is there somebody over here that wants to ask a question? Hello?
Hello? Yes, excellent.
Yep.
Hi, I'm Angus McCann. I'm a non-exec on the NHS Lothian board. I think many of us are aware of the capabilities that we have available to us that are well established and many pilots, and we're just frustrated about the pace that we've seen over years in terms of achieving scale and ubiquity. With Peter's presence here, I'm wondering about the role of inspectors, whether it's the Care Inspectorate or his, who have a very good view across the entirety of the country in seeing what is going on in our health and care system, and what role the inspectors might have, not just in passively observing what has been going on in our country, but in moving us forward.
Who'd like to ask that?
I suspect you'd like me to pick that up, Angus. So I suppose, thank you for the question. I'm glad to be able to answer it affirmatively in the sense that we've been working very closely with tech, and we have a member of staff who's actually dedicated to technology-enabled care based within the Care Inspectorate. In fact, we've just been doing some work with Iris and tech recently about how we potentially expand that influence. And I would entirely agree with you that inspectorate bodies like the Care Inspectorate have a really important and influencing role in how technology scales up. So we've been having those discussions. We've also been having those discussions internationally, because one of the questions I think that's been posed is about regulation. And one of the things that is testing regulators or inspection bodies across the world just now is how we keep pace with technology in a meaningful sense, so that we can ensure it develops quality outcomes, which I think is at the core of what we're talking about today. So I think there's something about how we grasp some of the learning from other countries. I've been talking to the Singaporeans, for example, which is fascinating because of some of the advances they're involved in medical technology, for example. So I think there is a real opportunity for us as bodies like the Care Inspectorate or HIS to take that influencing role forward. And I'm glad to say that we're at the centre ground of doing that right now. But can I amplify the point that was made about the workforce? I gave sense to that in my second issue. And I do think there's a job for us all here, because in some senses, as Jane said, we are the converted, in a sense. We all get this. I think it's going out there to equip beyond this room that is actually something that takes us to Lorraine's tipping point next. So there's a role for an inspectorate, absolutely, but there's a broader role for some of the bodies like IJBs, health boards, local authorities, and beyond that, the Scottish Government, to believe that we can actually say to people, this has now arrived, and it becomes a key integrator towards collaborative outcomes.
Okay, thank you, Peter. Jonathan, do you want to
Maybe
add
had a very quick point just to say that prioritising digital, board agendas across all organisations in the public sector, that's a clear signal that we are wanting to give. So for the first time, there's actually requirements on health boards to report and confirm what they're doing around digital and digital health and care. And that information and that detail will come through to us in Scottish Government. But I think it's just that clear signal, digital is important, digital matters, and we really want to be driving that forward now.
Okay. There's been a few questions popping up around prevention that people are asking, and also about prioritisation of spend linked to the current climate in terms of, I think one person made a point about, we're struggling to pay social care workers the living wage. How do we make the space to make the digital the investment that we need for the digital transformation? Others looking at, and how do you take that to the very front end of the system and move to a preventative approach? Jane, you're looking to come in.
So I think prevention and it's about living longer, healthier lives. It's not just about longevity. It's about actually the years of healthy life that people enjoy. And I think prevention is something that we have worked hard on across the whole system, whether it be local authorities and health and many third sector bodies to try and do that. But it is something we're still struggling with. So there is real potential in the digital area to actually make that much easier for people. We've seen quite a lot of promotion of mental health apps and prevention techniques and programs and so on. And certainly in the young population at the moment, that is having real traction. There's much more to do, but we can see where, if we can do things at a much earlier stage and give people the tools they want, not what we want. It's not about people of my age, sometimes it is, but quite a lot in that mental health space. A lot of young people are looking for something quite different. And we're starting that, but it's still a little bit piecemeal. And I think there's much to do, both in mental and physical health, about how we can make it easy for people. And to do it in their own time, not, you do it at 10 o'clock on a Tuesday. It's actually to be able to do it when it suits them to do it, and actually get advice in the manner in which it suits them, not in highfalutin language that people say, what does that mean? I don't understand that. It's actually, we need to make sure those things are designed to meet the needs of the population, and we should put ourselves where they are, not where we are. And I think in terms of the prioritisation of spend, that's also a challenge, isn't it? But if we don't invest in the future and we don't invest in prevention, we'll just continue to chase our tails. And if you look at the acute sector just now, we're seeing more and more patients coming into the emergency departments and so on. And we've been working across Glasgow and Clyde with local authority colleagues and third sector to try and think about doing things differently, because otherwise we'll be building more and more acute sector when actually that is not the direction of travel. And in addition to that, it's not right for patients and the local population. So there is something about us working together to prioritise some of this to actually make the future different from what it is just now, or else we'll just be running faster and faster to do an unsustainable kind of model.
I'm going to ask you directly. We talk a lot about prevention, but we probably all have slightly different perspectives on what we think prevention is. One of the questions that's come up is around prevention of long-term conditions. But in its whole sense, what do you think prevention is, and where do you think that resource needs to be shifted to support some of those long-term conditions that, despite investment, are on the increase?
I think that's a really tough question, actually. But it's absolutely right in the sense that I think the answer to that is, as the panel have suggested already, I think it's actually being receptive to what the individual needs and wants. And I think that what we have hopefully begun to do, which is maybe where the tipping point lies, Lorraine, is recalibrate our system away from technology doing things to people to actually being led by what they are able to use and understand, and fitting their understanding of whether it's a TV-based app where they press a button, which was partly, I think, what the video was communicating to us, saying there's a communication channel to my care service, maybe there's another communication channel to my pharmacy, etc. I think it's tailoring what people understand and what they have readily available to them to their needs in a preventative sense. So one example which Luisella really did speak to me about Turning Point, and it's a slightly different example, but maybe not, is that ability to get online at any time, day or night, and key into expert advice that actually gives you something about where you go next with the issue. Andrew Horn, I think, is probably in the room, and if you look at Addiction Scotland and Addiction and their use of a very similar platform where people have got an addiction issue and can go online anytime, day or night, and actually work out what next is there for them by way of support. I think those are the kind of applications that are literally in front of people in their rooms in that moment that can be truly preventative and frankly can also save lives. And I think it's for us then to continue to make the argument for investment to be done, as Harry Burns used to talk about, downstream much more readily than what I think we have done in the past. It's a tough ask, but technology unlocks good, holistic, person-centred care, but it can also unlock investment in different things, because I think some of what we invest in could be prevented if we engage person-centred technological solutions earlier.
Okay, thank you. So leading on from that, there's some questions about inequalities. I think Lorraine talked about the worried well, which is an expression we hear often about people worrying about the condition, going to hospital sometimes because of that concern. So how do you think we focus on reducing inequalities in what we do? Anybody want to pick that one up?
Again, a really difficult question. But if we look at many aspects of what we do, it does focus on inequalities and using digital as a way to handle that. So if you take the worried well out, but if you look at older people themselves, often a most vulnerable group, so how do we reduce the sort of age-related inequalities? And digital can do that if we do it right by getting the right technology to support people to give them the best life possible. I think there's lots of opportunities in digital to support work in terms of reducing loneliness and isolation, which then has an impact on health. Now, I'm not saying we can replace people with digital, but can we use digital to help engage, to get people talking in different ways, be it by Skype or by different ways? How can we make people feel engaged and reduce that loneliness and isolation? I think we're just at the start of those discussions. I think there are many health conditions that are inequalities related. The diseases that are worse are caused in part by poverty. And I think digital, but actually doing the prevention approach to that, digital can help address it. But I think it's one of the biggest questions for us, and I think digital can and maybe our role for those in the public third sector is how we can best use digital to get to the people that need the help most.
Okay, thank you. I think Angela wants to come in on that one too.
Yeah, I think it's interesting to look at the model we have adopted in Blackwood to address inequalities. And we knew very early on that if all of our customers didn't have access to the internet, they would remain remote from some of the things the rest of us take for granted. And that is a lot around health and well-being for sure, but also just, you know, having access to cheaper products, to online shopping, all the things that we probably, everyone in this room takes for granted now that they have access to. So we made a really bold move a few years ago and made the decision, and therefore had to find the investment to provide all of our tenants and all of our care customers with digital access. And we knew digital access was step one, because having access to the internet is great, especially if it is free or part of the service that you're getting. But you also need the device by which to access the internet, and a device that suits your needs. So we have lots of customers with profound physical disabilities. So giving them a tablet and nothing else will still make them excluded. So we've worked hard on that front as well. But also there has to be training and coaching, because even if you have those two components, the third bit is you need the support and eventually the confidence to make best use of that and reduce or improve how well people are included in society at so many levels. But as an organisation, that's a costly and time-consuming excuse me, exercise. And however, we are really seeing the benefits from that. And a lot of the testimonials we have, even for people who are out of a job and had to switch off their internet because they had no money to pay for it. Now it's part of their rental cost with Blackwood. So those sorts are the sorts of things that we can do to really tackle inequality in the system by giving everyone the basics that they need to be digitally included.
So just to add another thing to look out for the future is the creation of Public Health Scotland. And for the first time, we're going to have a national focus on inequalities. And that new body, which will be led by Angela Leach, who's currently Chief Executive of East Lothian, is going to bring together local authorities, health, you know, and other sectors together to really closely use data, use information, but really address those challenges in a different way. So, so the opportunity in the future is to engage with this new approach. You know, this is going to be the first time I think we've ever seen health and social care brought together in this way. So there are things for the future to look out for.
Okay,
Thank you,
Jonathan. Also lots of questions coming up around collaboration, best practice examples. There's somebody already put something up, a statement rather than a question around a peer mentor approach, which is working. Also comments around actually a number of our older citizens are pretty good digitally. So how do we maximise that? We've got changing generations. So collaboration, if we think about this person-centred stuff that we've talked about, how do we work better together as organisations, but actually how do we put people at the front of that in terms of those who are going to rely on digitally enabled care in whatever guise that looks like? Jane and Peter want to come in, but I'm happy to.
So I think we're working together across sectors better than we ever have. That doesn't mean we're there and we've not got much to do. We do. But I think the whole integration agenda, the work that we're doing with local authorities and health across that and IJBs to try and put people at the centre of that, we have got much to do around third sector, and that is an easy thing to say, but third sector is wide and varied, and therefore how do we actually engage in the totality of that third sector, and how do we make sure that we do maximise the potential of all the individuals we have and across the whole public service as well. It's not just those, it's about our community planning partners as well, and how do we actually utilise that expertise to actually maximise the outcome for people. And I think sometimes we try and do everything and we end up doing not too much. And so I think there is something about actually being absolutely focused on trying to do the things that our population tell us are critical, and actually trying to make some tangible change. But if we try and do everything, we'll not do anything. And I think that if everything's a priority, nothing's a priority. So I think it is important to be ambitious and innovative, but actually to think about how you translate that into real tangible change that people can see and are bought into. And that's as much about our collective staff as it is about our population. And actually, if you talk to staff, they know. I mean, they might not know the technology, but they know the things that are really important, and they're not always the grand, significant things. They're actually things that are really important to people, and they'll tell us. So it is about utilising the resource we have collectively to do that in a different way. And always the most fascinating part of my job, and there are many fascinating parts of this job, is actually going out and talking to staff and to patients and families, because they tell you what's important, and they'll also have quite often solutions to what we need to do. So across all of our organisations, we have got a huge amount of expertise, and there is a lot going on in that collaboration agenda. It's just how you maximise that into what I call synchronised swimming and make sure we've got the outcomes clear.
Okay, thanks, Jane. Peter?
Yeah, just a couple of points. It's difficult to answer all the questions because they keep rolling up, but I'm taken by that question about what are the practical steps to make this a reality. And it links to Angus's point about the pace of change. And I think there are some really positive, hopeful ways that we can make all of this happen. I would point to some of the initiatives through technology-enabled care, like Attend Anywhere, because I think it can be a completely powerful game changer right across sectors, very much person-centred and very much about bringing that ability to be person-centred closer to the individual. And if you haven't discovered what it's about, I think most people here will know, then I think it has incredible possibilities for the future. Another practical step is looking at scale-up. We have invested quite a lot in blood pressure and that kind of focus for just now, but there's many more opportunities around scaling up, around that person-centred, that much more self-managed and self-determined way of managing health. But it's much more than just managing health, of course, as we've described. And as there was one other opportunity, which is truly collaborative, is, and this is quite a tough ask, and I'm reminded of Scottish Care's rights charter around digitalisation, which I would encourage you to look at if you haven't seen it, which is about how we embody rights in what we do in the context of digital transformation in any field and in any sphere that we're working within. But I think one of the really powerful step forwards that could be yet another tipping point, and Luisella, you referred to that around the Australian model around person-held data and records. If we can kind of move towards that kind of further development as a nation, then that will make collaboration much closer to the individual, determining and driving their own needs. There's a bit clearly of a way to go, and it reflects some of the other questions around ethical considerations around data sharing and so on, which I think we are very well aware of. But it is something that could, I think, absolutely unlock much more around the powerfulness of person-centeredness in terms of people being self-determining into the future. So that's another milepost, perhaps, a little way down the road.
Thanks, Peter. So somebody has helpfully asked, on the basis of the responses, I'm sure, that given what we're saying about personalised responses, co-production, whatever you want to call it, do we think we know what the population wants?
Well, can I say that just one quick, and I'll stop talking, but the work that we've done with young people and young Scott, I think has been truly instructive in answering that question. Because at the end of the day, what I think many of us through our journeys of privilege in public service have learnt is that we know much less than we thought we did at the start of our journey. That's the way I feel, because it's much more about asking the question that elicits the response, which is actually, it's not about the average patient or person, it's actually about what you think you need and believe that you need. So I think when we've done the work with young people and young Scott, we've got the answer to that in sharp relief, which is not quite what we thought people would need around, for example, mental health and well-being needs that Jane referred to, and indeed things like chronic pain management. So I think it's engaging in processes like that that are meaningful, SallyAnn, that draw out real views and real meaning to what services should do differently.
Angela?
Yeah, it's just a reflection, I suppose. I've worked in many jobs over the years and have got quite expert at asking what people think of the service we deliver to them at the point of the transaction. And at that point, you say, did you like it or not? And do you think we could get better? And you get lots of rich data. We do that in housing and care. In care, you also ask a little bit more about, through that 6-monthly review process. To shift out of that mode, I think that we probably all in this room do pretty well, into the service design approach, which someone else mentioned earlier, is a different ballgame. So actually, you need different people and you need a different skill set and you need a different amount of engagement from the service users at that point. And I don't think we are as sophisticated in Scotland yet about how you get people involved in the service design, which may or may not include digital. And that's where we could definitely do with a little bit more of learning and sharing of good practice, but also exploring how others do it well in different countries and learn some of the lessons that have already been documented.
Okay. Lorraine?
Yeah, just to back that up, I don't think we could ever sit here and say that we know what people want. First of all, everybody's different, so I think the personalisation agenda is really important. But even taking the Scottish approach to service design, even if you can go and ask people, you have to keep asking, because what people want and need today might change next year, the year after. Back to Jane's mother-in-law. You know, if somebody asked her 2 years ago about digital and whether she'd be happy doing some stuff digitally, I'm sure she would have said absolutely not. Ask her at Christmas, and there might be some things on her Christmas list that she wouldn't have ever thought before. And she might be much more prepared to do some of her own care in some way digitally, or be happy to have more sensors or something there. So all our needs change. Also, the technology changes. So if you say, it depends on the question you ask, you need to start for what people need and ask the right questions. And we need to also make sure our staff keep asking the questions. One of the strengths of the Scottish approach to service design is we train lots of staff in it. It isn't just 2 people in an organisation who are trained in it. It's a technique that you want people to keep using day in, day out. Our housing teams, when they're working with people in our housing units, to constantly use these techniques, our care workers, to start using these techniques. I'd like to think we're there yet. We're not. I think in Scotland, we know where we need to get to, but we're still a long way away from that. But that approach to actually working with each individual or groups to understand what their needs are today and then trying to work through that.
Okay, so linked to that, then there's quite a lot of questions about workforce and about leadership. So not just on digital, can you just be interested in the panel's thoughts on whether you think that we're doing enough on leadership and on training and development? There's questions from, you know, how we encourage people into sectors because of digital, where we are with things like digital leadership, but also those points about, you know, if our approach to service redesign, do we have the right people with the right skills to be able to really make that change happen? Easy questions for you, but that's why you're here today, you see.
If I can, I think that we've already referred to the fact that we need to do more. I don't think there's any kind of way of avoiding that. We're on that journey, but I think we need to convince more people and we need to train them at their core. We've made some steps already about how we equip leaders at an early level, an early point in their career about digital. But I think there's a lot more to do. I think that part of the leadership challenge, as Jonathan has referred to it, is that it should be digital first on the basis of where we prioritise what we can achieve next on the agendas that we have within our various organisations, for example. And I do think there's a major job of work to be done in the wider workforce. Like you may have noticed, I'm wearing the care badge today. That's the green badge here. The other one is the care inspectorate one. You only get that if you work for us. But the care badge you can sign up for, and it is celebrating the value of care and the workforce that provides care in Scotland. And I think the message, therefore, is we should be equipping each and every one of those individuals with the knowledge and abilities that make them digitally enhanced in terms of their interaction with those that they support and care for each day. But I think we've got a way to go, and there's something there around leadership that means that we show up talking about the power of this on each and every occasion. And no, just to pick up the questions that have come by often, it shouldn't be about taking services away. It should be about enhancing customer and citizen experience. And that's why I think the theme that we've drawn out repeatedly over the course of this morning is about person-centred and empowerment first.
Okay, I think Jane and then Jonathan.
So I think there's undoubtedly, do we have a leadership and capacity in doing that, and also about our staff. I think what we've seen is quite, I mean, certainly in the health service, we've taken individual clinical champions, and they have a little bit of dedicated time to help us to drive that digital and agenda. Is that enough? Probably not. There will never be enough. I don't think it's one of those areas where you constantly have to review, as Lorraine has said, and constantly go back to see, have you actually got enough capacity? I think there's then the issue about how you actually get to the general workforce. And that is about as much about, I mean, most of our workforce these days in their home lives are very technologically savvy, but they do understand that, actually probably more than some of the leaders. But actually it's how we drive the innovation and use some of the innovative things that we've seen this morning and other places have come from individual ideas of our staff. You know, some of the things about, you know, even the things about using iPads for mums to see their babies from afar and so on. It sounds very simple, but actually that's had a huge and positive impact on people who can't be at the side of a baby in the neonatal unit the whole time. So from that perspective, some of these simple ideas have actually come from staff themselves. So I think there's the culture in our organisations we need to drive to make sure that there is that space for people to have the ability to have ideas. They, as I said before, they don't need to be those grand, earth-shattering new things, but actually things that they see in their day-to-day lives and those of the patients that they're working with to actually drive solutions which are different. And I think it's up to leaders to promote that culture, to ensure that innovation and a bit of space, we can never make a space for everything that everybody wants to do. I think I would love to say that we could do that, but I think reality probably is a little different. But there needs to be that space for people to be able to talk and generate ideas and actually drive that new innovation, as well as the general kind of e-health skills that we need people to have, and in that wider digital space. But if the tools are so difficult to use that actually our staff can't understand them, then actually we are not actually hitting the mark anyway. So I think that has actually changed quite a lot in the last few years and is much, much better than it has been. But as others have said, there is a huge agenda in front of us here to get this at the top of our agendas.
Okay, thank you. We're going to draw the panel session to a close. We're almost at 11:10. I'd like to thank the panel. It's a very brave thing to do, to sit in front of all you people and take quick fire questions. So thank you very much. A round of applause for the panel. Hold on. There was many questions that we didn't get to ask, but there's 2 days ahead. This has been a great start. Keep those questions on your agenda, take them into your workshops, think about them in other sessions, and thanks everybody for getting involved in this session. I'll hand you back to Margaret.
Yeah, just to say, I also give a very warm thank you to Christine and SallyAnn for again being brave enough to do that emergent sort of discussion. I mean, there's been 171 and it's still rising questions. I don't know if Mentimeter is live all day, is it? Does it stay live? So maybe what we do is, if people have points or questions that they want to make throughout the day, you know, please continue to use Mentimeter. I think we can pull together potentially some of the key themes and issues, and I'll give it to Jonathan on Monday morning to sort out. But I think there's a real rich sort of source of information there. Some of them are questions, some of them are comments, but I'm sure we can use that material. So please, if things strike you or you're in a presentation or whatever, please continue to use it, and I'm sure we'll be able to download it all. You're going out now for your refreshments, well deserved. You go into your parallel sessions at 11:40. The rest of the day really is those interactive parallel sessions. So there isn't a concluding plenary today, but there is the poster prize presentation at the end of the day. So again, we had some really, really good poster submissions. This is the first year we've done this. So again, I would urge you to go and look at those, and if those of you who can attend the poster prize presentation at the end of the day. And we're back here tomorrow morning again at 9:15. Again, a full day. So hope to see some of you then, and obviously a chance to chat throughout the day. Thank you.